Hello everyone. So let's start with the session of discussion of the anatomy related MCQs which has been asked in the Rajasthan MO paper 2024. So I am going to discuss all the MCQs related to the anatomy subject. So let's start with it. So let me start with the first MCQ being asked. All of the following structures associated with the pterygopalatine fossa except the option provided is maxillary nerve, pterygopalatine ganglion, greater petrosal nerve and mid-third of the maxillary artery. So there are four options and we have to mark the right answer. The question is being targeted on the content of pterygopalatine fossa. So in brief, I would like to tell you about the boundaries and the content of pterygopalatine fossa and then we can approach to the right answer. Meanwhile, the students can mark their right answer. So those who are live, they can definitely mark the right answer. So let's start with the discussion. So if I'm talking about the pterygopalatine fossa, it is located in with the close relations on all the aspect I'm going to discuss. So it is having lateral aspect, it is communicating with the lateral pterygomaxillary fissure. Superiorly, we have got the greater wing of sphenoid. Posteriorly, we have got the pterygoid process and medially we have got the perpendicular plate of palatine. So if you will see inferiorly there is the pyramidal process of palatine bone and more anteriorly there is the posterior surface of maxilla. So definitely it means these are the bones which is exactly lying in the close vicinity of the pterygopalatine fossa, being the having the maxilla bone posterior aspect anteriorly, having the pterygomaxillary fissure laterally, having the greater wing of sphenoid superiorly and pyramidal process of palatine bone inferiorly. So this is whole of the outline of pterygopalatine fossa. Other than that, it is also important to know in brief about the communications of pterygopalatine fossa. So अगर हम communications की बात करेंगे, it is communicating with the superior orbital fissure, it is communicating with that of the orbital apex and the middle cranial fossa. It also communicates with the orbit via inferior orbital fissure. If you will see the communication of the pterygopalatine fossa, it also communicates with the nasal cavity and thus happens via foramen which is termed as sphenopalatine foramen. Pterygomaxillary fissure. Actually, this has been asked several times that infratemporal fossa and that of pterygopalatine fossa is having communication via which fissure. So as I already told you, pterygomaxillary fissure is lying on the lateral relation of pterygopalatine fossa. Pterygomaxillary fissure forms a communication between infratemporal fossa and pterygopalatine fossa. It also communicates with the middle cranial fossa via foramen rotundum. Also communicates with the Viodin canal by the foramen lacerum, and we know that Viodin nerve is called as the nerve of pterygoid canal formed by the joining of greater petrosal nerve and deep petrosal nerve. It also communicates with the nasopharynx via pterygovaginal canal. So all these are showing about the communications and that of the boundaries of pterygopalatine fossa. Now thereafter I would come to the point that what most important content of pterygopalatine fossa. So the most important content is maxillary nerve. What is maxillary nerve? It is a branch, second branch of the trigeminal nerve, pterygopalatine ganglion, which is also called as sphenopalatine ganglion or ganglion of hay fever, and the third part of maxillary artery. The maxillary artery is divided into three parts via lateral pterygoid muscle, the key muscle of infratemporal region. So third part of maxillary artery, pterygopalatine ganglion and maxillary nerve. These are three most important content and the most important content of pterygopalatine fossa. So why I am marking? So actually greater petrosal nerve we will mark as the right answer. Please don't get confused because we know that greater petrosal nerve forms the joins with the deep petrosal nerve and it traverses toward the foramen lacerum and then gives in innervation to the important structure. So actually जब हम greater petrosal nerve की बात करते हैं, it is a branch of facial nerve which is carrying preganglionic parasympathetic fibers which synapses in the ganglion. What is the name of ganglion? Pterygopalatine ganglion. Now, it is a branch of facial nerve which is actually joining with the other nerve that is called as deep petrosal nerve. That is called as deep petrosal nerve, and actually in the connective tissue substance of foramen lacerum, the greater petrosal nerve will join with the deep petrosal nerve, which is a sympathetic in nature, and will form nerve to pterygoid canal. Nerve to pterygoid canal. Actually, the other name of nerve to pterygoid canal is Viodin nerve. What is it called as? It is also called as Viaden nerve. Now, this Viaden nerve is the nerve which is traversing through the pterygopalatine ganglion. We know that pterygopalatine ganglion is a content of pterygopalatine fossa. So please don't get confused because it is given, it is not given nerve of pterygopalatine, it is just mentioned greater petrosal nerve. So if I have to rule out one option and mark the correct answer, I will definitely go with greater petrosal nerve, which is a branch of facial nerve, which is not directly the content of pterygopalatine fossa. Now let's move on to the next question, that is question number 7. The nasolacrimal groove separates which of the following? The options provided is mandibular nerve and maxillary swelling. So, sorry, mandibular and maxillary swelling. These are swellings. The other option is lateral nasal swelling and maxillary swelling. The third option is medial nasal swelling and maxillary swelling. And the fourth option is first and second branchial arches. So, exactly we have to know the location of which groove? Nasolacrimal groove. Nasolacrimal groove. So to mark the right answer, I will show you an image, and meanwhile the students can give their right answers also. I will just wait for a few seconds. You can mark the right answer and then we can come up with the explanation of this question. So nasolacrimal groove का location हमें mention करना है. ठीक है, तो चलो हम डिस्कस करते हैं. ठीक है, तो यहाँ पे this is a diagram. Exactly the location of nasolacrimal groove will be in between the maxillary process and that of lateral nasal processes, so or prominences. So you can see in this image, I just want everybody to concentrate on this image. I'm slightly enlarging this image. So here the location of nasolacrimal groove. So exactly I am using this line. This is the nasolacrimal groove. And here the green color structure is lateral nasal process. I have written in short LNP, lateral nasal process. And the pink structure which you are seeing is the maxillary process, is the maxillary prominences. So exactly the location of nasolacrimal groove. In this diagram, you can see the location of nasolacrimal groove will be definitely between the green marked area, that is the lateral nasal prominences, and that of the maxillary process. So exactly the correct answer will be that. Other than that, one more image is there where also you can appreciate that this is the maxillary process, this is the lateral nasal process, and exactly in between these two the location of nasolacrimal groove is located. So definitely I would like to mark the right answer. Here the options are first and second branchial arches is not correct. It is not located at that location. Medial nasal and maxillary is also not correct. The correct answer is B, and the exact location will be between the lateral nasal swelling and maxillary swelling. So definitely we have got the B as the right answer. Okay everyone, so let's move on to the next question, that is question number 3. Cranial part of accessory nerve supplies all palatal muscle except the options are palatopharyngeus, tensor villi palatini, palatoglossus, tensor villi tympani. Actually, here you have to read the MCQs nicely. Okay, the language and the importantly, what are the keywords which is mentioned in this MCQ. So here they are telling cranial part of accessory. It is first thing that you should understand that accessory nerve, accessory cranial nerve is the 11th cranial nerve. What is it? It is the 11th cranial nerve. Accessory cranial nerve is the 11th cranial nerve, which is having two components. Okay, it is having two components. It is having a spinal component and it is having a cranial component. So whenever I am speaking about the cranial component, the cranial part of accessory nerve is running along with the vagus nerve, and it is having a wide distribution. It gives innervation to too many structures. Here बेसिकली जो क्वेश्चन है उसमें जो कीवर्ड मेंशन्ड है, वी हैव टू पे अटेंशन टू दैट द क्रेनियल पार्ट ऑफ एक्सेसरी नर्व इज सप्लाइंग व्हिच पैलेटल मसल, मींस द मसल ऑफ सॉफ्ट पैलेट, मींस बेसिकली दिस क्वेश्चन इज अबाउट द मसल्स ऑफ सॉफ्ट पैलेट. सो अगर हम करेक्ट आंसर की बात करें तो डेफिनेटली द राइट आंसर विल बी टेंसर विली पैलेटनी, because tensor villi palatini is a muscle of soft palate which is getting innervation from the vagus nerve carrying the fibers of cranial part of accessory. Now, so that is the right answer. Here So basically all the muscles of soft palate. लेकिन अगर हम tensor villi palatini की बात करें, it is not supplied by the cranial part of accessory nerve. It is the muscle which is supplied by a branch from trigeminal nerve. We'll come to this. Now, other than that, there is one more muscle, that is tensor villi tympani. So you can get confused from option B and D. Okay. So once more I am explaining it. So don't worry. So यहाँ पे B है और यहाँ पे D option. तो यहाँ पे सारे जो soft palate के muscles हैं, that is supplied by cranial part of accessory nerve except tensor villi palatini. Why? Because it is supplied by the branch from the trigeminal nerve. Tensor villi palatini is the muscle which is supplied by mandibular branch of trigeminal nerve. ठीक है. और यहाँ पे एक और ऑप्शन है जो है टेंसर विली टिम्पैनी. एक्चुअली टेंसर टिम्पैनी मसल, वी हैव गॉट टू मसल्स इन द मिडल ईयर कैविटी. One is stapedius muscle and another is tensor tympani. So tensor tympani is also supplied by trigeminal nerve, but यहाँ पे soft palate के muscle, palatal muscle ask किया गया. क्या ask है? Palatal muscle के innervation की बारे में बात की गई है. तो both of these are not supplied by vagus carrying the fibers of cranial part of accessory. But if I have to go with one, I will definitely go with B option, that is tensor villi palatini. The reason is tensor villi palatini is supplied by mandibular branch of trigeminal nerve. All other muscles of soft palate, that is musculus uvuli, levator villi palatini, palatopharyngeus, palatoglossus, all these components will be supplied by the cranial part of accessory. Now here I would also like to tell about the other muscle mentioned, that is tensor tympani muscle. We know that tensor tympani muscle is the muscle of middle ear cavity. Let's talk about in brief about the tensor tympani muscle. अगर हम tensor tympani muscles की बात करें, it arises from the cartilaginous part of auditory tube. Cartilaginous part of auditory tube. Now, what is the other name of auditory tube? It is also called as eustachian tube or pharyngotympanic tube. Okay. So, eustachian tube, pharyngotympanic tube, because it is forming communication between the pharynx and that of middle ear cavity. Now, here it arises from, if we talk about the origin of this muscle, it arises from the cartilaginous part of auditory tube and the adjacent part of the greater wing of sphenoid. Now, after that, let's talk about insertion. अगर insertion की बात करें तो it forms a tendon and it connects and attaches to the handle of malleus. Okay. And if I talk about its nerve supply, the nerve supply of tensor tympani muscle, it is supplied by mandibular division of mandibular nerve, and that is a branch of fifth cranial nerve. Actually, I would like to slightly elaborate this. Now, there is a, if I talk about this, both muscle, tensor villi palatini muscle and tensor tympani muscle, both are supplied by nerve to medial pterygoid. And nerve to medial pterygoid is a branch from the trunk of mandibular nerve, and mandibular nerve is a branch of trigeminal nerve. So, I would like to write that also. Please firstly understand. So, अगर हम nerve supply की बात करते हैं तो nerve supply of tensor tympani is from mandibular branch of trigeminal nerve. As the tensor tympani muscle is receiving motor fibers from trigeminal nerve, it does not receive any innervation from trigeminal ganglion, which is mainly sensory. So, I just want everybody to just note down one more information here. So, nerve to medial pterygoid, nerve to medial pterygoid. Nerve to medial pterygoid is a branch from trunk of mandibular nerve. It's a branch from trunk of mandibular nerve, and it innervates many muscle, medial pterygoid and the other muscle, but most important, it innervates tensor tympani muscle. It innervates tensor tympani muscle, and it also innervates tensor villi palatini muscle. So after this, it's quite clear, if the question is being targeted about the muscle of soft palate, then definitely the right answer in this case will be tensor villi palatini and not tensor villi tympani. You can get confused by this, but the correct answer is that of B, tensor villi palatini. So I would like to talk about the next question. So that is question number 4. Let me read it for you. So I just want everybody to write the right answer according to them in the chat box, those who are live. Many facial malformations are believed due to option A, failure in the growth of head, failure of neural crest to migrate to facial processes, failure of oral membrane to rupture, abnormal persistence of pharyngeal cleft. So, four options are there and we have to go mark the right answer. Here the keyword is facial malformation. We have to, so here the keyword will be facial malformation. What is the most important reason of all the facial malformation which we are seeing? So I would like to explain a few facts and then we can come to the right answer. Actually, according to me, the right answer is failure of neural crest to migrate to facial prominences. But before that, I would like to give you certain explanations. What happens during embryological development? The neural crest cells are exactly a group of cells that is very important and playing a very crucial role in the formation of many structures, and in that case it is also involved in the formation of many structures in the face. So migration into the facial processes. So if we talk about neural crest cells are responsible for migrating into specific region of the development of during the development of embryo, and one of it is the facial prominences. Eventually, which if I talk about this facial processes will give rise to facial structures like the jawbone, like the cheekbones, like the other facial features. So for that, migration of the neural crest cells is a very important and crucial role. So if there is any deformity during for the migration of these neural crest cells, that can lead to deformation of the face palate and all the structures being formed. So facial malformation, the same thing which I told you, अगर हम facial malformation की बात करते हैं, so if there is a failure of neural crest cells to migrate properly into the facial processes, it can lead to abnormalities. It can lead to various abnormalities in the development of facial structure. अगर कोई भी neural crest cells is not able to migrate properly when the development of facial processes is being taking place, this can lead to many of the abnormalities like it can lead to certain abnormalities like cleft palate, cleft lip, and abnormal fusion of the developing component of the face. So it will also impact the abnormal or the defective migration of neural crest will also pay impact on the facial development. Proper migration and also the differentiation of neural crest cells is required, and it's a very essential component for the proper formation and presentation of the facial tissue. If there is any disruption in the migration of neural crest cells or differentiation of neural crest cells, there can be formation of various facial malformations. Okay, that is an important point. So that means with this, it is absolutely, if we are going to mark the most correct answer in this explanation, what I told you, failure of neural crest cells will lead to abnormal formations of the facial malformation is the most correct answer among the options provided. Okay, so we will mark B as the most correct answer because that will form various abnormalities in the facial developments. Let's move on to the next question. Okay, dear. So hypobranchial eminences contribute to the formation of, the options are, it is forming the musculature of the tongue, it is forming the epiglottis, it is forming the anterior portion of the tongue, it is forming the posterior portion of the tongue. So this is also a very good question, and we have to mark the right answer. So here actually if I have to mark the right answer, I will definitely go with one of the option, and I'm coming to the reason why. दो ऑप्शन है एपिग्लॉटिस और पोस्टीरियर पोर्शन ऑफ द टंग, जिसमें आप कंफ्यूज हो सकते हो, लेकिन आई विल मार्क posterior portion of the tongue as the right answer. I am coming to this, I will first explain you and again I will come to this MCQ. Let's come into the discussion. So agar the first point is that you have to know what is hypobranchial eminences. What is hypobranchial eminences, dear students? It's a midline swelling of the third and the fourth pharyngeal arch. So basically hypobranchial eminences is corresponding to which arch? It is corresponding to the third and that of the fourth arch. It is very important component in the development of tongue, and it appears during 5th to 6th week of embryogenesis. Now अगर हम hypobranchial eminences की बात करें तो mostly it is derived from the endoderm of third arch and also from the fourth pharyngeal arch. So it is mainly derived from the endoderm of third and that of fourth pharyngeal arch. It quickly grow over the whole of the copula and forming earlier by the second pharyngeal arch and will lead to the formation of the posterior part of the tongue, posterior one-third part of the tongue. That means hypopharyngeal eminences will definitely lead to the formation of posterior one-third of the tongue. That is quite clear during this explanation. Now, so we are quite clear that the posterior part of the tongue is the right answer. But other than that, I would also like to add more, and I would like to tell about the various important developmental events in the tongue. Okay. Now, tongue believes to be start developing. Tongue is believed to be start developing during 4th week of intrauterine. It's very important. Why you should note down this? Because in the previous year of examination, the 4th week of this time was asked when the tongue starts to form. Now, second, third and fourth pharyngeal arches is, agar overall baat kare to which arches are contributing to the development of various part of the tongue? In that case, the answer is first, second, third and fourth. So first, second, third and fourth overall is contributing to the pharyngeal arches, contribute to the formation of the entire tongue. The development of tongue begins with the medial swelling, which is corresponding to first pharyngeal arch, and this medial swelling is called as tuberculum impar. What is it called as? This swelling is called as tuberculum impar. Now, here you can see the developmental component of the tongue, as you can see the lingual swellings, the tuberculum impar is there, the hypobranchial eminences is there, and further this is leading to the formation of different part of the tongue. Now, again, अगर हम बात करते हैं तो this will merge. If I talk about the development of tuberculum impar, it will merge with and lead to the formation of anterior two-third. So mucosa over the tongue has its origin corresponding to that of, अगर हम mucosa की बात करें तो that development is corresponding to the sensory innervation. It is corresponding to first pharyngeal arch, and that will correspond to the sensory innervation, which is via branch of mandibular nerve, that is the branch from trizer. Actually lingual nerve is there, and lingual nerve we know that it is a branch from mandibular nerve, and mandibular nerve is a branch of fifth cranial nerve or the trigeminal nerve. So lingual nerve is very important. It is giving general sensory sensation on the anterior two-third part of the tongue, and the other one is coda tympanic nerve. So please don't get confused with that. Actually, coda tympanic nerve is a pre-traumatic. It is a pre-traumatic branch of the first pharyngeal arch. So that is giving taste sensation to anterior two-third part of the tongue. So please don't get confused with that fact. Okay. So got it? Now, meanwhile, so if I talk about further development, meanwhile, the mesoderm of second, third and fourth pharyngeal arch, another midline swelling is there, which is called as hypobranchial eminence, begins to develop. And it will lead to the formation of posterior third part of the tongue. Okay. So we are knowing that anterior two-third part of the tongue is getting innervation corresponding to first pharyngeal arch development. So its innervation is via lingual nerve and that of the coda tympanic nerve. अगर हम posterior part of the tongue की बात करते हैं तो it is formed from the mesoderm of second, third, fourth pharyngeal arches, and which is another swelling is there, median swelling. Actually hypobranchial eminences, which is corresponding to pharyngeal arch third and fourth, and basically second pharyngeal arch corresponding part is buried, and only the third and fourth is contributing to the formation of the posterior one-third part of the tongue. So mucosa overlining this area will get sensory innervation from ninth cranial nerve mainly, and posterior most part, अगर हम posterior part of tongue की बात करें, it is getting innervation from ninth cranial nerve, और अगर हम posterior most part of the tongue की बात करें तो it's develop from medial swelling corresponding to the fourth pharyngeal arch, and its innervation will be via superior laryngeal nerve, and we know that superior laryngeal nerve is a branch of vagus nerve. It's a branch of vagus nerve. Okay. Now the muscles of tongue, अगर muscles of tongue की बात करते तो muscles of tongue is predominantly formed by myoblast, which originates from occipital somites, occipital somites, and the innervation of all the muscles will be via hypoglossal nerve. Here also we have got an odd man out, that is platoglossus muscle. Platoglossus muscle is innervated by the vagus nerve carrying the cranial part of accessory nerve. Please don't get confused with epiglottis, because epiglottis is also developing from caudal most part of hypobranchial eminences. So many of you can mark epiglottis as the right answer, but I think the question here, if I have to mark one answer, I will go with posterior portion of the tongue as the right answer. The reason is that because epiglottis is formed from the posterior part of the hypobranchial eminence, but hypobranchial eminence is definitely forming the posterior portion of the tongue. So if I have to choose one, I will go with D as the right answer. Both are correct, but I will go with D as the right answer. Let's move on to the next question. Okay, so we have done with this. So exactly this was only asked here. So we have done with this. If you have got any doubt, you can just let me know. Okay, so यहाँ पे just a quick revision, as all of you have solved this MCQ. So I just want to tell कि hypobranchial eminences is contributing the formation. So yes, caudal most part of hypobranchial eminences is contributing to the development of epiglottis. लेकिन अगर overall hypobranchial eminences is contributing to the development, I will mark posterior portion of tongue as the right answer. Anyone, just a quick before ending, a quick recapitulation is there. Same goes with the other question. यहाँ पे भी this was a confusing one. Okay, we have marked this fifth. Okay, many facial malformations are. So we have got other factors which also contribute to facial malformation, but most important contribution is the right answer. I will definitely go with failure of neural crest to migrate to facial processes. That is absolutely right answer. Okay. Now, other than that, cranial part of accessory nerve supplies which palatal muscle? If you read this question nicely, they are asking about the palate muscle, which is getting innervation from cranial part of accessory nerve, which is not getting innervation from cranial part of accessory. We know all the muscles of soft palate is getting innervation from the vagus nerve carrying the cranial part of accessory, except tensor villi palatini by the branch from the trigeminal nerve, that is mandibular nerve via nerve to medial pterygoid. The other one is tensor tympani, which is a muscle of middle ear cavity. So here soft palate के muscles को concentrate किया गया था question में, which is not getting innervation. So we will go with tensor villi palatini as the right answer. This was a easy one. It was a direct question. Nasolacrimal groove का location पूछा गया था. So definitely after seeing this image, we are quite clear that nasolacrimal groove का exact location है जो nasolacrimal groove is located between the lateral nasal process and that of maxillary process, which is great. Okay, so that is the right answer. Now coming to the first question. So here actually, we have just discussed pterygopalatine fossa in brief so that we can mark the right answer. All of the following is content except, so yes, the option was maxillary. Pterygopalatine ganglion, which is also called as sphenopalatine ganglion or ganglion of hay fever. Maxillary nerve is the second division of trigeminal nerve. Mid part, third maxillary artery branch, also the content of pterygopalatine fossa. Greater petrosal nerve will be the right answer, which is a branch from the facial nerve, which is not directly exactly the content of pterygopalatine fossa. It will join with the deep petrosal nerve, and then the fibers will form the nerve to pterygoid canal, the wider nerve that will relay in pterygopalatine fossa and will give innervation to many of the important structures, the nasal glands, palates and all. So that definitely we will mark that as the right answer. So after this discussion, we have quite come to the end of all the MCQs being answered. If you have got any doubt, you can ask in the Telegram group or also in the live chat. So before ending, I like to tell get your doubts cleared. Write itself in the DBMCI MDS group on the Facebook and Telegram. Don't settle, don't stop. Okay, so read and solve as many as anatomy MCQs and all other subjects included for your exam. So you just practice making the MCQs after your concepts and your has been covered, after giving one or two discussion of the topics. And if you have got any difficulties in not understanding any MCQs, or you can directly ask your doubts, which can be cleared by the faculties of the MDS group on the Telegram group and Facebook. All the best. Keep studying. Thank you so much.